So this is a model of the human heart. This is obviously not life-size. Our heart is roughly about the size of our fist, so it's a little bit larger than that. So looking at the exterior of the heart, we can identify the 4 chambers of the heart. So this right here, little piece here, is part of this chamber of the heart, and that is the right atrium. We turn it this way, we're seeing this little piece here, and that is part of this chamber here, and that is the left atrium. Down here are the 2 lower chambers. This chamber here is the right ventricle, and this chamber over here is the left ventricle. And they are divided. You can see this like curve, this groove in between those 2 chambers, and that groove there is called the interventricular sulcus. So it's a groove between the 2 ventricles. Okay. Also what we see exterior is that we're going to see some blood vessels. So arteries are red, veins are blue. The exception is pulmonary. When we're looking on the heart, these red arteries are the coronary arteries. The blue guys are cardiac veins. So this over here, you're seeing that blood vessel on the heart, that is the right coronary artery. We flip it over here, this is the left coronary artery. So, as I said, arteries are red, veins are blue, except for the pulmonary arteries and veins. So this guy right here is the pulmonary trunk. And this is going to branch off here, and if I turn this guy around, you can see the branch comes in, and some of them branch this way, some of them branch that way. Both of those are pulmonary arteries. And so those are taking blood to the lungs. The ones right here and right here going into the left atrium, those guys right there are the pulmonary veins, and they are red. So that is the opposite thing that we see normally. Switching us back around here. This big blood vessel going up above the right atrium, this is the superior vena cava. And if we turn this around once again, you're going to see a little nub right there, and that is the inferior vena cava. So this is the superior vena cava, and this is the inferior vena cava. And it's been cut off, so we don't see much of it. Looking at arteries here, this is the aorta right here, and this is the aortic arch. So this is the aorta, and this is the aortic arch. Now we're seeing 3 blood vessels coming off of the aortic arch. The first blood vessel right here is the brachiocephalic artery. The middle one is the left common carotid artery, and the last one is the left subclavian artery. So this is the brachiocephalic artery, left common carotid artery, and left subclavian artery. Now what you're going to see here, this little white piece right there, is a remnant of the ductus arteriosus, and that remnant is called the ligamentum arteriosus. So the ligamentum arteriosus. So now let's take a look at the internal anatomy. So if we open this guy up several different ways, so pull this off here. What you're seeing, I'm going to turn this around. So right there, that is the tricuspid valve. Now this once again, is the right atrium. And if I turn this here, this chamber right there is the right ventricle. So the tricuspid valve right there is between the right atrium and the right ventricle. If I turn this around to the other side here, once again, this is the left atrium, this is the left ventricle, and so this valve right here, between the left atrium and the left ventricle, that valve there is the bicuspid valve. It's easy to remember because there is an R in tricuspid, which indicates the right side. Looking at the other valves here, we're going in through, once again, this is the left ventricle here, this is the right ventricle. The other valve here that we see right there, that is the aortic semilunar valve. So blood is going to get pushed through the aortic semilunar valve from the left atrium or left ventricle into the aorta. The last valve that we see right here is the pulmonary semilunar valve. And here blood is going to be pushed from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. What you are seeing in the walls of the ventricles are these muscles that project upwards. So this is a very large one, here is a smaller one, here's an even smaller one. Those muscles there are called the papillary muscles. So those are the papillary muscles. And these are attached to these little cord-like fibers right here. These little fibers right there. And those fibers are called the chordae tendineae. So when the papillary muscles contract, it's going to pull on those chordae tendineae and it's going to close those valves. Between the two ventricles is this structure here, and that is the interventricular septum. So that is the interventricular septum. Inter means between, so that is a septum between the ventricles. Looking at the layers of the heart wall, the outer layer, which really is indistinguishable, but the outermost layer here is called the epicardium. The middle muscle layer here is called the myocardium. Myo means muscle, so that's the myocardium. And then what lines the heart chambers is this layer right here, and that is called the endocardium. So myocardium, epicardium here, myocardium here, and then endocardium here. Lastly, there's this structure that we see through the right atrium there. We can also see it through the left atrium right there. And that is the fossa ovalis. And that is a remnant of the foramen ovale, which was present in the fetal heart. So those are the structures on our heart.